first and foremost, $100 million, what are you going to do with it?
Hi, Caroline. Well, thank you for having me on today. Maybe I'll start off by just sharing a little bit about what Color actually does. So we are a company that provides essential and public healthcare services in the context of where people's lives actually happen. And so, over the last couple of years, we've been building and deploying services across the U.S. In very different settings, whether it's like schools, universities, workplaces, even community settings like churches. So now we're running almost like 7,000 either testing or vaccine sites. And so to your question about what we're planning on doing with this fundraise, but also just generally in our operation, is that what we found is that in general, when we're thinking about health equity and access to essential healthcare services, one of the biggest factors in people being able to access basic healthcare is the immediacy of access and simplicity of access. And that's the big driver for everything that we do, which is to take these essential services and deploy them in the context of people's lives. So I'm happy to walk through a few examples of that if that's helpful.
I'm interested as you walk through those examples, because I know that you've been, offering COVID services to the likes of California, Massachusetts, the state governments, the universities. But there's also an awful lot of other places that want to become closer to all of us, give us access. I'm thinking of CVS. I'm thinking of the pharmacies on the high street. They want to be able to give me my flu shot, to be able to walk in and continue the testing that they've currently provided when they gave the vaccines. How are you going to tackle this sort of a competitive space?
Yeah, so I think it's, first of all, I think it's such a vast and challenging problem that I don't think there's going to be a single way to do it. But I think one of the things that we have seen time and time again across different industries is that when you bring immediacy, when you take things closer to people, you actually get an exponential increase in utilization of various services. And that's what happened, for example, in retail and e-commerce and other services like that. And the way we think about it is like when you think about, like, say, school children, for example. Right now we're running thousands of both testing and vaccine sites in schools. And when you think about how do you serve the school-based community, the most logical and low-friction place to do that is in schools. And so, the way we think about it is like I think there's a place for centralized healthcare, which is the traditional model we came from. But when we look around the world and, as well as other examples of other industries, the ability to take things into the context of people's lives and into their communities, we believe to be one of the biggest things we can do for public health.
Absolutely. I mean, goodness, being able to get my flu shot here and work, seismic, so easy when you've got a busy life and trying to care for my own kids myself. Othman, I'm interested in, as you look at a $4.6 billion valuation now, you're a company that knows how to pivot. You were doing, what was it, genetics testings originally, sort of like the competitor 23andMe, and you pivoted well. I'm interested in, therefore, how your relationship evolves, not only with companies, with governments, but also the insurers. Are you going to be working in lockstep with them? Because what's so interesting about COVID is almost we didn't have to worry about the insurer. It was the federal government that wanted to put these things in our arms.
Yeah, it's a great question. I think one of the effects of the COVID crisis, obviously it's been, an incredibly challenging window of time for all of humanity. But I think in these times of crisis, what tends to happen as well is that it creates a mobilization that moves people out of a local maximum. And the thing that we've seen is that all of the key stakeholders in healthcare and in public health have dramatically changed their approach. Like we're seeing that with innovative departments of public health, like in California, Massachusetts, a number of other states. Some of the largest manufacturers of healthcare kind of services and supplies, like Thermo Fisher, PerkinElmer, and so on, have all taken a very big step up to drive access and immediacy of these services. And so I think like the other big thing that's really changed is our own expectations. Like through the last couple of years, we've all seen that it is possible for us to receive basic services in a way that's way more convenient as part of our lives. And I think that expectation is not going to change, it's not going to go back. And I think that is one of the biggest shifts I think that's happened in the entire industry, at least for the last 20 years. And so I think this is going to be a big shift that when we look back, I think a decade from now, we're going to see as one of the big threshold moments for how we think about public and population health.
And Othman, you were mentioning how you've looked at other countries and seen how perhaps they more efficiently do things than versus the US. Are you looking at international expansion yourself as well?
So we have, in fact, actually, pre-COVID, we were doing a fair amount of non-US work, but through the COVID crisis, there has been such a huge need locally that has been the biggest kind of driver of our own focus, just to be able to serve our community and the kind of the country where all of us at Color are mostly living. But frankly, like the same pattern of using technology to distribute basic building blocks of healthcare, I think is actually something that is going to apply in a number of other countries, slightly differently because the way the finances work will be different through a single payer system versus not. But the essence of the distribution through a technology first and high leverage model, I think is something that's actually going to apply quite globally, so not just in the US.